Acentra Health is the beneficiary and family-centered care quality improvement organization, also referred to as the BFCC-QIO for 29 states. One of the responsibilities of the BFCC-QIO is to perform hospital discharge and skilled service termination appeals for Medicare beneficiaries who feel their care is ending too soon. Hospitals provide hospital-issued notices of non-coverage, also known as HINNs, to Medicare beneficiaries with original Medicare. The focus of this video is the HINN 10, also known as the Notice of Hospital Requested Review, or HRR. The HINN 10 is also provided to Medicare Advantage enrollees. This notice should be given to beneficiaries when the hospital has determined that they no longer meet inpatient criteria for a continued stay and the attending physician disagrees. The notice informs the beneficiary that the hospital is asking the BFCC-QIO to review the case and that they may be contacted for more information. If the patient has a Medicare health plan, the plan should work with the hospital in situations when both agree the enrollee is ready for the next lower level of care and the attending physician does not agree. The following are the responsibilities of the hospital. Hospitals must notify beneficiaries that the hospital has requested a review by giving them a copy of the HINN 10. Hospitals will need to communicate to the BFCC-QIO their need for a hospital-requested review. Typically, this is done by calling the BFCC-QIO and speaking with a representative. Hospitals must provide any information that the BFCC-QIO needs to conduct its review and must make it available by phone or in writing by close of business on the first full calendar day immediately following the day the hospital asks for the review. The following are the responsibilities of the BFCC-QIO. The BFCC-QIO will review the medical records related to the services, call and seek the opinion of the beneficiary, and will then issue a determination. If the records are not received by the end of the first full calendar day, the BFCC-QIO must notify the hospital. The BFCC-QIO determination must include the following information: a statement explaining the beneficiary's financial liability and the liability date, if any, a statement informing the beneficiary of his or her Medicare appeal rights and the time frame to request an appeal. The determination is binding on the beneficiary, physician, and hospital, except in the following circumstances. If the beneficiary is an inpatient and is dissatisfied with the determination, he or she may request a reconsideration. If the beneficiary is no longer an inpatient and is dissatisfied with the determination, it is subject to the general claims appeal process. If it is determined that the beneficiary is ready for discharge after the HRR, the hospital should issue the HINN 12 so the beneficiary is aware of his or her financial liability. The reconsideration process for the HRR is the same as for the expedited appeal. If the beneficiary chooses to ask for a reconsideration, there is no protection from financial liability. To download the model language for the HINN 10 or for information on how to complete it, visit the Beneficiary Notices Initiative website at www.cms.gov/BNI. If you have any questions about Acentra Health or any of the content in this video, you can find our contact information on our website at www.acentraQIO.com.